All right, welcome back, everybody. Lori, I'll turn it over to you. I'm going to spotlight, get everybody all pinned and ready to go.
Okay, fantastic. Hi, everybody. Welcome back from your waiting room. Thank you for allowing us the time it took to make sure we were spot on with technology so that you get the fullness of this esteemed panel this afternoon. We've had a long day. It has gone by like that. I don't know if you all felt that, but a lot of information, and thank you so much for all your engagement. We've learned a lot from you. And really, as I've been saying, to put a big, beautiful bow on what we've learned all day, I personally hand-selected this panel. And I call them an esteemed panel because my heart is overflowing to share them with you. As I grew in my leadership role, like you all, you see people who have skills and talents that either you don't have and you learn from them, or people that you have those core values in common with. And each and every panel that I'm going to introduce right now, one way or the other helped shape me and helped inspire me to continue being a leader and to focus on what the most important thing is: patient and family and the teams that we serve. So I'm going to go in order of how long I've known these people. Maureen Cole, raise your hand. Maureen, I met at New York Presbyterian, is a director of women's and children's services now at, Maureen, I'll let you finish your introduction yourself.
Sure. I'm at Stony Brook University Medical Center out in Stony Brook, Long Island. I've been there, going on 7 years. It goes by very quickly. But it's been quite a learning experience, and it's always an adventure. So I'm very excited to be part of this. So thanks for having me.
Thank you, Maureen. And I will tell you that Maureen is a fierce voice for the team that are serving vulnerable patients. A fierce voice, will never give up. And it's those of you that are in the neonatal world, Maureen transitioned from pediatric to leading pediatric, all of children's and obstetrical services. So that transition can be done with great success. Dr. Anu Subramony, hospitalist, physician. I'm going to keep using that word fierce. Pam Spivey brought that up today. Fierce voice for quality and patient safety. Anu, tell us where you're at.
Good morning / good afternoon. I am Chief Quality Officer at Cohen Children's Medical Center and have been in the role for about 6 years. It's part of the Northwell Health System. I had the great opportunity to work with Lori and Maureen at New York Presbyterian. I've known, I think, both of them since I was a baby attending. I'm a pediatric hospitalist and do a lot of patient and family-centered care research. So super excited to be a part of this group and to kind of share some thoughts. So thank you.
No, thank you. And it's been so great watching you thrive and flourish, Anu. Dr. Pidge Lohr. Pidge is a colleague, an ex-colleague of mine from Kaiser Permanente. Pidge, share with the group where you're from.
Yes, thank you. Lori and I did indeed survive Kaiser Permanente together and live to tell about it. Really great experience, so much I learned there. I was chief nurse for the Central Valley at Kaiser Permanente, and then I went on to regional and national leadership positions before being recruited to beautiful, sunny South Carolina, where I am now the Vice President of Acute Care for Prisma Health, which is a 12-hospital largest healthcare provider in South Carolina. It's an infant organization. It's 2 legacy organizations, one in the Midlands, more down south in South Carolina, and one in the upstate that came together to form Prisma Health. And, you know, we have big plans to be multi-state and start offering our own insurance offering as well. So most of my clinical background has been in emergency services. And as you can see, I just had 2 new grandchildren. So your world is near and dear to me for sure. And I'm just really happy to be here again with these esteemed colleagues. And we are still colleagues, Lori. We got to get rid of that X.
Yeah, that's true.
There's no such thing as ex-colleague.
I got it. I bug you enough anyway. And I will tell you, Pidge is, her fierce area, a couple, is mentoring new leaders. And she did her doctoral work in that area. And then also just so passionate about the professional practice of nursing that I really learned a lot from Pidge. Monica Davila and I have recently met each other, and what I want you to hear and see from Monica, I don't want to spill the beans, but just your heart, your authenticity and compassion. And we talked a lot about values this morning, Monica. I know you'll appreciate that. But Monica, tell them when you became a chief nursing officer, Monica.
Good morning, afternoon, everybody. So yes, right in the middle of a pandemic, which has been an exciting and awesome growth, learning experience. So as Lori mentioned, you know, Lori and I have recently connected, and it's been amazing to have her by my side in the last couple of months. I'm currently at Stanford Healthcare ValleyCare in Pleasanton, California. I've been in the organization close to 7 years now. My background is perioperative nursing in the surgical arena, but about close to 2 years, I took the leap and went into the inpatient nursing world, and it has definitely been a very amazing journey and rewarding experience. Thank you.
Great. Thank you, everybody. All right, so we're going to jump right into the discussion and fireside talk, if you will. And I hate to say it, as you all were talking and I'm seeing your faces, Pidge, Dr. Pidge, I'm picking on you first. We all have lived through a lot this year, right? And we're different people than we were a year ago. And I think all of our leadership has changed this year. And I would ask you, because you come from emergency nursing, emergency management too, just ask you, going through the pandemic and leading organizations through the pandemic, what's been the biggest change on your approach to leadership? Or maybe something didn't change, it just became stronger. I was wondering if you could share your insight on that with the group.
Oh, thank you, Lori, for the opportunity to go first.
You're so welcome.
And I see that I have Ashley and Karen are two Prisma Health nurses here, which I had no idea. This is super exciting. So I want to delve into that. Hey, put in the chat where you guys work, just curious, because I'm in the hospitals all the time, would love to connect. So I have only been with Prisma Health for about 8 months. So the only Prisma Health I know is the COVID-19 Prisma Health, right? And as we all know, at whatever level of nurse leadership you are in, physician leadership, you are in a different organization because of it. And we've all been flying this plane as we built it, right? We were all experts in everything and nothing all at the same time as we really tried to determine how to respond. One thing that I do think that I was able to see throughout coming to an organization in the midst of a pandemic and moving across the country in the midst of a pandemic is that we still can never underestimate kindness and using kindness as really a leadership tool. Because not only did we face professional challenges, but we and our team members faced incredible personal challenges, whether it was childcare, whether it was illness, whether it was managing not only what was going on at home, but trying to be the emotional support for our patients who no longer had visitors, right? So remembering that we have to treat everyone with kindness as our first tenet, because it was a really, really hard period. And as part of kindness, it goes with approaching people and situations with the benefit of the doubt, right? There are many times we've stepped on toes or had our toes stepped on as we've advocated for patients, advocated for our disciplines, advocated for what processes needed to change. And sometimes I think it's easy in that crush of a moment to not consider that everyone has good intentions right now. So let's take a breath, take a step back, and really think through what's happening. That and flexibility. I think above all, we learned flexible has got to be the name of the game. We've all got to be like giant Gumbies, right? Able to jump on a video call or run down the hall and take care of a concern. We have to be able to manage on the phone, lose that connection of not seeing each other, but still manage to stay together in the work. I think kindness and flexibility are the two words I would say that came really up high as we approached COVID-19
Well,
and continue.
Pidge, thank you so much for that. And I love your comment about giving people the benefit of the doubt. You know, when we are so stressed and so challenged every day, and the politics and the bureaucracy of it all, sometimes you can easily lose sight of that. And to remember that, to focus or center ourselves around kindness, but giving people the benefit of the doubt. And this was like no other. You know, we've all been trained for different crises. I bet everybody on this Zoom meeting has been in the command center in one way, shape, or form or another. And being kind, not knowing what people bring to that crisis. This crisis, we've had crisis at work, but then you go home and everybody's impacted at home too. So it took on a whole new identity, you know, living through a crisis. So thank you for that. You mentioned a few other words, or one word twice, that really resonates with nursing leadership right now and really connects well with what we talked about this morning. You said advocate for patients and families, and advocating for our staff or resources that we needed. So we talked this morning about getting the confidence to use our voices. And, you know, I'm sorry, I'm picking on people in the group. I should have told them which exact question. Next time, if you ever agree to do this for me again, I'm going to tell you exactly which question. But I'd love to, for you being a female physician leader, a female physician, and then a female physician, I think your full title, did you say your whole fancy title? I was just going to call you Fancy Schmancy, but no one would know. I mean, Chief Quality Officer, Vice President for Quality and Safety at Cohen's Children's Medical Center at Northwell, one of the biggest systems in the country, with a big title, and you're a woman. So using your voice and advocating for children's, okay? So advocating for children's within a big system is not easy to begin with. So I'm wondering if you could just share any insights with this group to help us have the courage to, when we are in our seats, and many of us are in seats at tables where big decisions are being made. Any insight in how you can help us have more confidence?
Yeah, first of all, I just want to say thank you. Many years ago, Laurie, you gave me a book about being an authentic leader. It was probably one of the first books on leadership that I had ever received. And this was, again, when I was a baby attending and just starting out as a faculty member, as a pediatrician, pediatric hospitalist. But I want to just pick up something that Pidge, you had mentioned about kindness and kind of what is your driving force. You know, over the last couple of years, as I feel like I've been trying to navigate this, coming from a kind of mainly female world, a lot of, you know, young mothers, you know, women in pediatrics, to a leadership standpoint where there are a lot of males. It's been a really, I think, a learning time period for me. And I want to pick up on something what Pidge said around being kind. And kind of pivot that a little bit. So my, you know, as a pediatric hospitalist, I loved talking to families. I love learning about people. You know, when Maureen and I worked together, I loved hanging out with the nurses and, you know, going out for drinks, and my style has always been relational. I think one of the things that I've learned over the last couple of years, and I think that the pandemic has really pushed, is how to flex my style a little bit and start kind of thinking about using things that are outside of my sweet spot. So for example, using things like muscular language. I strongly suggest that we should adopt this COVID protocol, or I strongly suggest, and I feel like this is very important, that we adjust our visitation policy during the pandemic. So trying to kind of use kind of things that are outside of my own kind of sweet spot. And I encourage all of you guys to try that as well. As Lori said, I'm an agent of change. I'm work on quality improvement. I'm always doing things differently today than I did tomorrow. And I think that that's something that has been a passion of mine for a long time. One of the things that I've tried to use some of those skills in things like meetings, when you're with your CEO, in scenarios where you're in the command center and you're with people who you're trying to impress, is trying to kind of pull on those strings to be more directive or be more forceful, right? While at the same time still keeping that kind of inner value, authentic leader of being kind, of being kind of warm, and really trying to get a sense of kind of what does the group need? How do you motivate a group, whether it's somebody, a unit-based or a leadership-based? How do you motivate them to think like you do? And I've really found that, using different types of language has been really important. It's also kind of not just what you say, but how you appear, how you portray yourself. One of my PDSA cycles, personal PDSA cycles I've been working on is, I'm the kind of person you're telling me something, I'm like nodding. I'm like, yeah, even if I don't necessarily agree. So one of my PDSA cycles from last week is stop the nod, right? I may not agree with you, but let me give you that nonverbal communication about, we're going to have a conversation. This is not about me just saying yes to you. Okay. So learning some of those skills has been super important.
It's so hard, right? I find myself doing that, and I really do agree with you. So it's not hard to do, but there are times if someone's saying something that's going off the rails, I'm trying, number one, not to roll my eyes, and number two, not automatically just go because I'm so used to I'm listening to you, I'm with you. I think that is key. Beautiful.
I just love all those comments, and I hope you all are writing down these nuggets. I put the muscular language in there. I love that. And not negative. It's about being assertive and just more directive on where we want people to go. I love it. And did you say stop the nod, STOP, right?
Yes.
Oh my God, I'm implementing the PDSA on Monday. Thank you very much. I love that, Anu. Thank you. Something that jumped out on me, so I'm going to tee you up here, Maureen, so get ready. When you were speaking, I just kept remembering how you interacted with people. Like you said, whether it was the front line, and you didn't have to tell everyone we went out for drinks a lot. And I actually think they closed that bar. They closed Coogan's, I think. It was terrible. I saw it on Twitter. I couldn't believe it. Anyway, sorry. Every hospital has a local bar. But when you were interacting with people, and then I would see you with your colleagues, other hospitalists or new residents coming in. I saw you doing that a lot, teaching. And then with our work with the Family Advisory Council, so communication is important. And I think we all know, but I published a white paper it's got to be about 9 months ago, and 250 nurse leaders responded to this survey. And one of the things that jumped off the survey results or into the white paper was about the complexity of communication. So you have the ability, Anu, to communicate to all different types of people. During a pandemic, communication is hard enough, okay? I teach all day sessions on communication. It's hard enough, but then layer the global pandemic when information was changing so fast. I'm picking on Maureen because one of the things that Maureen seemed naturally talented at, from me, her chief nurse, was that she could connect with the frontline staff. Now, she was like a senior director already at New York Presbyterian. Connect with the toughest group of people, not that I didn't love the pediatric intensive care unit nurses, I loved them, but you were able to go in there at some of the toughest times and they would be like practically hugging you when you left, and that would never happen to me with them. Anyway, so Maureen, I ask you to think about when you were communicating all the rapid fire questions and then policy changes during COVID in your role now, and what you saw worked and what you saw didn't work.
Yes, it was a great learning experience, I think, COVID and how people communicate. We all think we're communicating, but then we're not communicating anything. And so I think my biggest message to my leadership team, and continues to be, including the medical team, because you're a team doing all of it, we all say that we're listening to people, but I said, you have to do more than listen. You have to hear what they're saying. And I think we forget that while we all say, oh, we're listening, like we're on a meeting and then we're doing something over on the side, you've missed what was heard. And I think that's where you win that relationship with your team, is that you listen and you hear. And it's that mutual respect to say, I understand what you're saying. You know, COVID was a fear for everybody. I think from a children's perspective and from women's, we were not as impacted as greatly as the adults. And I had to change, and I have to say the NICU was probably the hardest group to change, because they didn't want to take any care of anybody over than 12 months and blah, blah, blah. So the message to them was, I hear what you're saying, I hear your fear, but there's somebody's baby or child on another floor and they need our help. That could be your child. And, you know, as old as they might be, they're always going to be your baby. So we were able to get them to float out as helping hands to other units. And when I tell you, I think the largest group impacted by what they saw in the adults and figuring out what they could do to help was probably the NICU nurses. And they came back and they were like, oh my gosh, I can't believe you made us do that. But it was such an eye-opening experience to really see what's going on. Like they were able to see, while we were saying things are bad, we need a help, they actually went out and saw it firsthand. And they did fundraising. And if I told you how much money they raised, it was unbelievable. They proceeded to make a care package for wellness for every single employee in the hospital. And they did it on both shifts. And they themselves went around and delivered it and said, you know, greetings from the smallest hands in the hospital. Thank you for everything you're doing. So to get them to get to that point, I think was huge, but you had to hear what they were saying and then help them get to the next step. And I think that's kind of what I've always done with my staff when I lead. I go out there, like we were visible. We were there covering 20 hours a day of leadership. You know, we didn't stop. We were, you know, it was great. Meetings were less. So you were able to be out there more with the staff. Now, unfortunately, the meetings are back. And I said the other day, we need to get out there again. We need them to know that we're here, and you need to be able to listen to what they're saying and hear what the underlying message is, because you can't make change if they don't think you believe in what they're saying.
Oh my God.
So I think that those are the biggest things.
My God. I mean, your comments were very, very profound. I was writing very quickly, and you talked about listening and hearing. And, you know, when those of you that are spending a lot of time in diversity and inclusion right now, diversity, equity, and inclusion, you know, some people make the mistake that diversity is race only or culture only or age. Diversity and inclusion is about hearing and understanding, because you can check a box very easily, but if you're not really hearing what people have to say that makes them uniquely different, and you're not inviting them into that conversation, you're not going to get where you need to be with diversity and inclusion. And Maureen, you then quickly transitioned into that results in people are going to feel respected.
Yeah, and I think it was wonderful, because I think, you know, nobody knows the people in the women's and children's world. We live in this isolated world at times. We were able to come out and show what makes us so great, that we are able to care for anybody and clearly care for our colleagues, regardless of where you work. And I think that was the biggest impact. I mean, I even had Child Life involved. And
Wow.
Child Life dressed up as a unicorn and went out just to say hi to the staff. And I never knew a unicorn was so popular before, but it was the biggest hit we ever had. And it was just little things like that that I think make a difference. And it helped us get through it, I think.
Well, and you said that they went out and helped, but I'm gonna actually correct you. You went out in front of them and you led them and you showed them, and that is beautiful. It's beautiful. And they followed your lead, and what a big impact then make, you know, fundraising for their colleagues. That's a beautiful story, of which should be published or something as a case study that I may circle back to you. So you're going to be sorry you mentioned that, but see, I mean, just great leadership. And when I listen to each and every one of you, I hear, well, it just validates that I knew the people to invite. And I hear what fuels you every day. I hate the question that many of us gets asked, what keeps us up at night? I always 100% of the time flip that around into what gets me up in the morning. And you can hear with each and every one of you. And Monica, you know, the notion that you were put into one of the most complex roles in healthcare, being a chief nursing officer. It's one of the most diverse roles. You are expected to know the broadest array of information and broadest array of competencies. The chief nurse, you know, I always define a chief nurse like this. You know, well, HR does HR all day. Finance does finance all day. You know, maybe the vice president for quality, not the nurse people, the operations people does quality all day. The chief nurse has to span the entire enterprise and spend time each day, right? And for you being a brand new leader, getting, I don't want to say thrown into, being divinely appointed as a chief nurse right before the pandemic or during the early days of the pandemic, what would you say were your go-to what was your guiding post to get through that for yourself? Because it's a scary place to be in.
Absolutely. Definitely a very scary place to be in, right in the middle of a pandemic, when you have a whole group of people looking at you for direction. You know, one of the things that I held on to through this time was really ensuring that I stayed authentic, that I stayed me, genuine, and that I was very transparent with my teams, with my leadership team too. Be able to say, I don't have the answer. I don't know what's next, but together we'll figure it out. I think it's important to you know, that transparent communication, being able to be visible with your team. And, you know, in situations of crisis, is important for your team to know and to feel that even though I don't have the answer, I'm standing next to you side by side to figure it out. As a group together, we will figure it out. You know, I spend a lot of time in the units, as many of you did, very long hours. I could recall, you know, when our first patients were coming in, I had a group of a unit where they would not take care of patients. They would not go in the rooms. It was a very difficult message, 9 p.m. at night, house supervisors calling me, and we have patients COVID positive, they don't want to go in the rooms. It took a lot of me to, you know, anxiety, absolutely. Fear, for sure. Did not know what I was going to walk into. But, you know, just communicating and giving them that direct, compassionate communication in the moment and saying, listen, you're right. It's scary. I'm scared. I don't know the answers. I don't know what's next, but where's the PPE? I will go in with you in every room that we need to go in together, and we'll figure it out. So for me, it's been very rewarding to see, you know, nursing and interdisciplinary teams come together in this time, and just learning from them, the resilience that they've had over these last couple of months and continue to have, it's mind-blowing. And to be able to see that and to be able to grow from that, to be able to lead through this has just been a very humbling experience. So for me, it really is being able to be transparent with your team, continue to be your authentic self, be true to who you are, and don't try to boil the ocean.
Good, well, good advice. Good advice. Monica, thank you so much. And couple things that you said. I mean, you guys are all so amazing. Couple things you said. I mean, the authenticity and being yourself. It just, that resonates the most with people, with team. They can sniff out insincerity in a second. So being yourself and admitting that you don't know something, that takes a lot of courage. And I think there's a lot of us, a lot of leaders who fear that admitting that you don't know something is a sign of weakness, or even worse yet, that you know everything. And it's just not true. Being human, being yourself. And actually, you know, I always torture people with the evidence, always the science, the science, the science. And what the science says is that people really just want you to be yourself, be authentic, and be competent. Mm-hmm. And us as leaders in healthcare, we can't be experts at everything. And clinicians, you can be an expert at this much stuff. You can't be an expert at everything. And as a leader, that's really important to understand, because then you can tap into other individuals and say, hey, I know you're an expert at change management. I know you're an expert at quality improvement. Can you help me? It's just not something I want to learn from you. It's really, really a profound skill to learn. And what I see in Monica is her ability to be honest and say, okay, teach me what I don't understand. I'll tell you what I don't know. Help me. And that speaks volumes. And then something else you said speaks back to when Alexandria was doing her closing remarks, because Monica, you said you went on the unit and you said, I'm scared too, really profound. And give me the PPE, I'll go in. Leaders go first. Leaders go first. So not a long quote or saying, but leaders go first. And when you're leading change, and when you're leading during times of uncertainty, the leader going first is critical. When you're earning trust with others, give the trust away first. Leaders do it first, model the way. So I just, spot on, Monica. Thank you so much. We have about 10 minutes before I'm going to open it up for questions. So attendees of the pre-con, get your questions down for this amazing group. But in the closing moments, I'm not going to pick on any of you anymore. You will get to volunteer, just like raise your hand there. You know, healthcare, nursing, physician leaders, frontline have been on all of our news feeds for over a year. You can't get away from it. So I think that's a great thing. It's a silver lining. We have the spotlight, all right? And for me and many colleagues, we don't want to let go of the spotlight. We want to make use of the spotlight. So what do you see, if you had a magic wand, what do you want to help with? What do you want to lead? What do you want to see change? A lot of questions there. Or what do you want to see not go back to the way it was? Not go back. Just final words of wisdom. I'll start to give you guys some time to think. One of the things I don't want to go back is the pace of change. When Alexandria was speaking so eloquently on change, you know, it takes forever for us to implement change, and it's complicated, and then it doesn't stick. We saw change happen like that in an instant during COVID. And granted, it wasn't an ideal situation by far, we know that, but people's acceptance of new and innovative things for the benefit of our patients and families and for our own protection. I don't want that to go back. I don't want it to go back. But anyway, back to, if you had a magic wand for keeping this spotlight on healthcare, what do we want to see differently? And Pidge, yes.
So, and Lori knows I'm very passionate about this, that as nurse leaders, and it goes a lot to what Dr. Anu was saying as well, right? That we have to lose that oppressed history that we've lived with for hundreds of years in the nursing profession and as women. And I think if we look at the really the way that we have been expanding the woman's role in general, and our voices are finally being heard, and for nursing to finally be at the table, I don't want to ever give that up, right? And, you know, we talked about how we show up, right? And at Prisma Health, we have our mission is inspire health, serve with compassion, and be the difference. And for me, be the difference means, because I'm a leader, it is inherent in my role to speak up, even if my voice is shaking, even if I'm afraid of the room, even if I'm feeling intimidated. I have to control what I can control, and that's how I show up to every conversation. So for the new leaders, I want you to picture a hula hoop around your body. And you can be at a meeting where everyone else is in their hula hoop spinning out of control, right? Or yelling or screaming or, you know, being negative. You can only control what's happening in your hula hoop, right? Does anybody hula hoop? There's not a lot of room for anybody else in there, right? No, I can't keep a hula hoop up, but I can get it around my body, thank God. So that's what I want you to think of. You are only in charge of what's happening in your hula hoop. And that translates to me in we have to be thoughtful and purposeful how we show up in every interaction. That stop the nod, totally doing that. Totally going to start that because it's a problem that I have, and something that I think as women and as caretakers, we always want to be empathetic, and we always want to be, oh, I'm hearing you, I'm hearing you. But sometimes doing that yes is, yeah, I'm agreeing with you. And you might be, well, wait a minute. No, I don't agree. So let me try and just sit still and give you the eyes. So you know that I'm listening, but I'm not quite there with you. So that's my number one, is I want us to keep our voice, keep showing up, and show up with courage every time, because we're nurse leaders and we know what we need and we know what it takes more than anybody else at that table. Take care of our patients.
Pidge, I love that. I love the hula hoop. And Anu, I'll get you 1 second. And you talked about letting go of that past, like that victim, referring back to what Anu had shared. And, you know, I think about let it go, let the past go. Because if you're always looking backwards, you're going to crash, right? If you're always looking backwards, you're not seeing the future. So I'm stealing that, by the way, Pidge, just saying. I'm stealing that. Letting go of the victimness from you and Anu. Thank you for that. Anu, what would you like to share?
So I think one of the things that I think I don't want to let go of is our focus now on employee safety. You know, the whole patient safety kind of work in healthcare started in the airline industry, right? Where, you know what, the pilot, the other people on the airplane, they were, you know, if something went wrong, they were going to die too. Right. So, you know, really thinking about employee safety, we started on that journey prior to the pandemic at my institution, but it really took on like such a different meaning when it came to, you know, obviously our PPE, you know, and protecting our employees from COVID. I think the other kind of really part about employee safety is around kind of personal wellness, well-being. You know, one of the things, you know, as we've had all these kind of remote meetings here and there, I'd meet with, you know, people who would apologize when their baby cried, right? And I said, I want to hear your baby, because that means that you are a real person, right? You know, my kid walks through, you know, after the shower on the Zoom or whatever, right? This is real life. We're real people. And I think acknowledging both that, you know, we're more than, you know, our wellness is not just what we bring to work, but it really is our physical wellness. It is our emotional wellness. It's what we do to kind of keep ourselves centered and keep calm. and support each other in that way. And I'm really hoping that, post-pandemic, that's something that we as a healthcare industry can continue to pay attention to and work on.
Thank you. Thank you, Anu. As you were speaking, I feel like I've been confessing all day. If you all can't tell, I was raised Catholic. But anyway, when you were speaking about, we're all human. And if your cat walks by the Zoom or somebody cries or whatever, I'm a little wound tight. I want everything exactly like when I realized today that you guys were going to log in at the same time we were probably finishing up. I was like, that's not the way it's supposed to work. So we're a product of our upbringing and our environment. And I just so appreciate that, to give ourselves some grace and that we are human. And Monica, I'm going to get you 1 second. I was on a big Zoom call the other day and somebody was screaming, crying in the background, and a brand new baby. And I was actually teaching the class. And I said, okay, I want everybody to stop and recognize that we have a colleague, a student who is in class anyway, probably hasn't slept in 3 nights and is here, and we kind of gave them a round of applause. So I really appreciate you calling that out. They're human. And I hope it does. You think we would be good at taking care of our own. We're so good at taking care of others. We kind of forgot ourselves along the way, right? So thank you. Let's not let it go back, any of us. Monica.
Yeah, Lori, thank you. I think, piggybacking on something Dr. Subramony mentioned was the focus, the intentional focus that we've had during this pandemic for the mental well-being of our teams. I think that's super important. Prior to COVID, absolutely, organizations have programs to support the well-being of our teams, but I think it's critically important that the focus that we established during the pandemic for our frontline teams, whether it's provide a buddy nurse on the floor to help remove that stress of a new grad, or whether it's ensuring that you're monitoring the lunch breaks or the 15-minute breaks, or having the flexibility with schedules. Mother, because of school, might have to work, I don't know, half a shift, and how flexible are our managers, our leaders, to support these teams so that their mental well-being is in a better place and they can present to the patient in a better mental state. So I hope that this intentional focus that we're having right now about the mental well-being of our teams continues, and that there's bigger evidence-based practice and bigger programs to promote mental well-being, not just for obviously nursing, but all of our clinical teams. I hope that we continue that.
No, I agree completely. And it's not just about having EAP. And I don't know how many times I gave a policy to someone, oh, okay, you might need EAP, but to really live it and breathe it. And it's really part of our practice, And Monica, you touched on something, it wasn't part of our conversation today, but I would say you talked about staffing a little bit, that someone might have to work a different kind of shift, or we have to support them differently. I'm going to just say it. The nurse staffing model hasn't really worked fabulously in as long as I've been a nurse. It doesn't work. And finance always seems to be not happy with us, right? I really think it needs to be innovated and blown up, and just to support our new and different needs and lifestyles and the new and different needs of our patients. So thank you for sharing that. Maureen.
So I think the one thing I don't want to see go back, which I think we really knocked down silos, was learning how to understand how everybody else works. Like, it wasn't focused just on my unit. It was, what can we do for the department? What can we do for the division of nursing? What can we do for our medical colleagues that were getting pulled from peds units to go work adults, and they were petrified, and the support that we were able to give each other. I don't want to see us go back to, well, that's nursing and that's doc. It was it was a team. Like when we did, you know, TikTok things just to break up the monotony every once in a while. And I did get in trouble from TikTok because I guess we used some song we weren't supposed to. But anyhow, it became competitive. I mean, you know, the residents and the nurses were all in these videos, and then it went house-wide. And it became an institutional competition. And then it became us competing about other hospitals that were in our system. I said, oh my goodness, we sparked something here, but I want that to continue. I don't want it to go back. This is me, and I don't really care about the other side because that's
Right.
adults or that's whatever. So it'd be nice to see that.
Well, and I love that, and it goes back to, I think, Pidge's comments as well, as let's not be victims. Let's not say nursing doesn't have this, nursing doesn't have that, and know what, we're a team for the patients and families we serve. And that's the way we need to think about it. So I appreciate your comments, and I've heard that from many leaders nationwide, that the collaboration that happened instantaneously was the best thing one of the best things to come out of COVID.
Laura, can I just piggyback on something that Maureen said? I mean, I had the great opportunity to take care of adult patients. I'm a pediatric hospitalist, have been for 14 years now, had not taken care of an adult in a long time, but did have that opportunity. And I think, you know, one of the things that really struck me was, you know, as being a, you know, pediatric providers, nurses, physicians, staff, how well we take care of patients and their families. Yeah. And, you know, some of the adult people that I worked with were like, what, you want to talk to the patient, and right, you want to, you know, do family-centered rounds, and you want, you know, you want to feed like the patient. I was like, yeah, we're doing it. We're getting in there. And so, you know, it was really reflective on kind of what we can bring to the table. And, you know, that I think has now stimulated some more collaboration with our adult colleagues on doing things with that pediatric flavor, because I think do think about patients and families kind of in a different way. So it was a nice way to get out of the silo and really understand that there's so much more opportunity that we as pediatric providers can do to influence the rest of the world.
Absolutely. And I love you modeling the way of that. And God forbid you wanted to talk to the patient and family. What were you thinking, Anu? I just love it. I love it. And it's right on time. It is, well, 12:35 by me, 3:35 Eastern time, and everything in between. I'm going to open it up for about 10 minutes for questions from our attendees for the pre-con today. You have a unique opportunity to tap into these amazing leaders. So please take your phone off mute and raise your questions, or type them in the chat, but we'd love to hear your voices. So I have a question from Teresa that says, is it Teresa? How will you focus on employee safety? Was that just a comment or a question for us to address?
Sorry, it was a question for the person who talked about employee safety and the focus on that.
I mean, I think that there's a lot that we can do, and I think we've kind of started scratching the surface. We're working at our organization on overexertion injuries from, you know, specifically around nursing staff moving patients, and then also a big emphasis on protecting our staff against injuries related to behavioral health patients. And, you know, before we started doing this work, I didn't know what a Galvo was. I didn't know what any of these things were. But I think learning about kind of some of the impact that some of those staff members have had to their lives, right? I think is really important. And I think the more we highlight the fact that an employee gets hurt, that's the same thing to me as if a patient gets hurt, right? I take that seriously. We need to do everything in our power to be able to prevent those things from happening, and taking that same approach is really important. And the same goes for infection control and kind of our PPE usage and how we do that.
What other questions are there from the group? Pam, go ahead.
Well, I had a question. Many of you mentioned the long hours, supporting your teams. As one who looks at resilience and well-being, what did you do to rest, renew, and go again?
Maureen.
So we opened up a wellness room for the staff, and we made sure that there was time, and it was for everybody. It wasn't just, one group, where we had massage chairs and we had relaxation and other things that we could provide. So we made sure that while we did that during the pandemic, that we continued to do that. And we've dedicated space dedicated just for everybody who works in the organization to do that. I made sure that my leadership team did the exact same thing. So, when we all come to work when we're just not feeling well. And I said, no, that doesn't happen anymore. You don't feel good, you stay home. You don't want your bedside nurse is there, the same thing goes for you. You have to lead by example. So you're not feeling well, stay home. You need to learn to turn off your phone when you're off. Like, they'll say, oh, I'll call in for that meeting. I said, no, you won't, because I'm not going to invite you to the meeting. So yeah, you have to, really encourage them to do all of that. And I made them plot out time off. I was like, you have to take your time. You have to take care of yourself. And I had to lead by example. I mean, I don't think I went on vacation for 1.5 years. And I literally said, okay, I'm taking a couple of days off and I'm not answering my phone. I cheated. I looked at emails, but they don't really know that. But, you have to do it to show them that we have to take care of ourselves, because we can't take care of our staff if we're not taking care of ourselves. So that's kind of what
Thank you. I love that, Maureen. And I just want to highlight that you modeled the way by taking time off, but you also had the influence to ensure, I don't want to say force, but to ensure that your team took time off. And I would ask that each and every one of you have leaders, you all have a sphere of influence. So number one, model the way, take care of yourself. And number two, have those conversations with your teams. And not, are you going to take time off? When are you going to take time off? Especially if you have direct reports that are leaders, many of you do, sit down with the next quarter calendar and say, okay, everybody gets a week or two off. Which ones are you going to take? It's not an option, and make it a team expectation. I think that's fabulous. We have another question, couple of questions in the chat. We'll see what we can get to. Luann asked a question about, we talked about that we have hope that will continue, that you all talked about what you hope will continue as lessons learned from the pandemic. What strategies do you have to ensure that the new normal sticks? So the things that we don't want to change, how are we going to ensure that it doesn't go back to the way it was? Do any of you have any advice for that?
So it's Pidge. The one thing I'll say is that I think that we are right in the midst of answering that very question, because while it feels like the COVID is mostly behind us, there are still areas of the country that are greatly impacted. So, I personally don't like the term the new normal, right? Like I'd like to blow that up. I don't know, I don't have an answer for it, but I'm concerned because new normal means that we're going to accept, and we could have a tendency to get complacent again with something else. So I want to know, how do we keep disrupting the status quo, and how do we keep working to make it better? And how do we keep challenging ourselves and our teams to keep going? I know one thing that I'm challenged with, and I'm sure many of the leaders on the call are, is that it seems like while nursing and physicians, the frontline clinicians, were working crazy hours and 24 hours a day, some of our colleagues in some of our other departments had some extra time on their hands, and they have been saving up some projects and think that March, April, May are like these fabulous times to be launching new toolkits. And it's very hard, even at my level, to get this and say, I feel like I need to be the gatekeeper. And, you know, again, you don't want to be the victim and be the negative one, but we're rolling out tiered safety huddles across our organization. Monday, the chief nurses got it Friday, right? This is a huge initiative. So what I've asked the chief nurses to do for me is get the gap for me. What's the gap between what they want us to do, what's happening now, and the realistic time frame that we can commit to being part of that tiered huddle safety. We all do huddles, but they want this certain format. So you have to be able to stand up and say, look, this is important, but it's not a yesterday. I'm the nursing leader that can triage what we need to do right now. So that's one frustration that I have. So I think we're still navigating how do we get to that next level of where we're really thoughtful about what recovery means. Yes, we want you to take all this time off, but then I want to give you a toolkit that needs to be implemented within the next 2 weeks, right? It's nonsensical. So I think we're still building that plane as well as we fly it.
Well, and I appreciate that, Pidge, because we're just going through it. So we might not have the exact answer, and that's okay. We're learning, we're figuring that out now. And I think that's actually a really, really strong message to have, but also to make sure your teams, whether it's your unit teams or a service line or the entire hospital, have taken stock in what you have learned and what you don't want to change, because things that you don't want to go back might not be the same things as your colleagues. And you know, when you do a lot and read a lot on high reliability organizations and the safest organizations, they are learning organizations. And we have to live our value of being a learning organization and say, hey, what the heck did we learn? Let's take stock of that. Let's write them down. Let's agree upon, have a, you know, shared conversation, and let's name the things we don't want to go back. Because once you agree on what you don't want to go back, then you can, those are shared expectations, shared agreements, shared expectations. And then you can remind each other and say, hey, no, we're getting really negative about that thing that didn't work. We promised ourselves we wouldn't do that. And then you have an existing agreement and you go forward. But if you don't take stock, you don't really know. You don't really know.
Lori,
Monica.
and you know, just to echo what Dr. Pidge was saying regarding, you know, we really don't know what we want to keep and what we want to continue, because as we sort of navigate out of this pandemic and post-pandemic stage, to Dr. Pidge's point, a lot of other teams, the perception is, yes, we're back to where we are here. Let full course ahead. We're gonna implement all these projects or these things, but the frontline staff, nursing or physicians, clinicians, we're still sort of in that, you know, just coming out of all the anxiety and the stress and still to some level of COVID mentality, where they're not really ready to accept all these new projects, initiatives, and it's a barrage of constant you know, a more level of anxiety for them to be able to accept some of these oncoming projects. So it's definitely, we're in a place where as nursing leaders really being able to advocate and have that voice to sort of triage a lot of these in flight or in the moment projects that we want to get back to our new normal. So as we triage those things, I think we'll be in a better place to really identify, you know, where we're going to be moving forward and what that change is going to look like.
Great. And we only have time to answer one more question. There are quite a few comments about resilience activities and initiatives. and really how to do it more than just, like we said, EAP or showing empathy. What are some real tactics we can take? And I just wanted to open it up to see if anybody had specifics. You know, there was a post by the American Nurses Association chapter in California. They're a little bit more provocative than the other ANA chapters. And they wrote, "No amount of deep breathing and yoga will help us. We need something real. No amount of yoga." Now, I'm a big yoga fan, and we learned some really good techniques from Pam Spivey today with some meditation and breathing. So it's not that that's not important, but is there anything else that we can build in for in perpetuity? So like it's part of our structure and how we do our work. Any suggestions?
So Laura, you might remember when Bonnie St. John came and presented to us at Kaiser Permanente to the nurse leadership forum that we had. And Bonnie St. John is a para-Olympian who won gold. And I believe she had one of her legs removed as a child for some issue, and won gold, right, as a para-Olympian. And what she embodies, she has several books out, so I can put her name in the chat. But one thing that I think we can bring all of our team members, because we're going to need to have some of it be self-care, right? So we're going to have to give our team members self-care practices. We're not going to be able to get to everybody in a very timely fashion. And one thing that she embodies is micro resilience. So it's little activities of resilience that you do during the day or when you're going through a season that help remind you of who you are, what you have going for you, your blessings, if you will, what you have inside of you. And it might be as simple as she creates a joy jar, right? So it's a jar on her desk. She has little Post-its. You write something good that happened today. You will find every day something good happens. I don't care how bad the day was. And it might only be that your coffee was the perfect temperature. You put that down, right? You're feeling blue, pull a few of them out. Take a look and be reminded of what good is happening in your life. I always thought I wanted to see if I had it. Oh, I do. It's my resilience box, right? My micro resilience box. And I have a damn it doll, right? So I can hit. And I have like a little massager for when I'm going crazy. Oh, my camera.
Pidge, you hit your video. You hit it so hard your video went off.
All right, I'm sorry. I have a micro like massager in here. I have a little sock monkey, right? I have like little balls I can throw across the room and not hurt anybody, hopefully. I have a fan because, women get hot flashes, right? So you never know when you might need that. And so this is my box of fun. I've brought it to command centers. I've brought it to staff meetings. It's just something that lightens the mood. Because we're all going to need, number one, to take care of ourselves. And we're also going to need to give our team members their own strategies to employ as we consider how we are going to provide for the mental health and well-being of all of the people under our responsibility.
Lori, if I could add to that.
Closing comment, Anu?
The closing and aspirational, but I think, to piggyback on what Dr. Pidge said, I think what we've experienced over this last year is having people outside of healthcare really understand what we do, right? The nursing shift gets there at 7 o'clock, 6 o'clock in the morning, right? Because there are patients there, we don't get holidays off, we have to work. And I think, having the, people outside of healthcare really understand how important we are to ourselves, our communities. I think that I'm hoping in the next, 10, 15 years that we're going to see some dramatic shifts from a societal level on how much we value our industry.
Yep.
So I'll leave with that.
I love that. And I love that muscular language you used, dramatic shift, I would like to highlight. But I agree with you, and I hope that doesn't change and go back. I wish we had 2-3 hours for this panel. I want to start a standing ovation. I put the clapping in my window there. I can't thank you all enough. Maureen, Anu, Monica, Pidge. I know everyone feels like I do. we could listen to you forever. You've lived it and you're leading it. You've lived it and you're leading it. And we just thank you so much for taking an hour out of your Sunday to be with us, just to share your insight. And we've learned a lot. So thank you so much. Thank you very much.
Thank you.
Unanimous.